You get osteoporosis in your 20s or in your 30s. So think about your bone like a bank. The more activity I do, the more I deposit in the bank.
Okay.
Your bone strength is directly proportional to the stress you subject it to. When I talk about bone health, we're just looking at its strength, its integrity, its capacity to withstand force. If we lose that, then it becomes brittle. So any change or any force through it causes it to break.
Hi guys, as always, my name is Dr. Hope Simiyu, and today I have a lovely guest. I'll let her introduce herself.
I am Eva Langat, professionally Dr. Eva Langat. I am an orthopedic and trauma surgeon based in Nairobi. I primarily do a lot of sports orthopedics because it's a passion of mine.
Okay.
Occasionally I'll do a bit of trauma here and there,
Yeah.
but my main focus is sports medicine.
So we want to talk about bone health, of course, touching on osteoporosis and osteopenia and just bone health overall, to see what are some of the things that we're probably missing as patients, and now focusing on the pillars of health. Of course, socioeconomic status comes in, there's diet, cost of living is high, capitalism is a thing, so we're not getting enough vitamin D. So we just want to have that conversation to see how we can optimize our bone health. And even as women, because our reproductive health is always just there trying to fight us.
It makes us, it's our superpower, but it's also our Achilles heel.
Exactly. So what are some of the things that you're seeing today when it comes to bone health that people are either prioritizing well or missing the mark?
In the recent past, I think probably in the post-COVID era, there's been a big push towards healthy living.
Yeah.
You're seeing, so it's very interesting. COVID time,
Yeah.
because of that, now we're seeing a lot more injuries.
Okay.
Because now guys who have been sedentary have now decided to start working out. So then they get injuries because of that, or they were spring cleaning and climbing ladders and came tumbling down. But in the time after that, there's been a big push towards healthy living. So people have changed their eating habits. People are actively exercising or engaging in one activity or the other. I've seen online, and I suspect you've seen the same. There's also been a big push towards supplementation and what can we take in terms of supplements. I can tell you for a fact that probably if I see 10 patients in the clinic, 5 to 7 of them are actively exercising. So they'll tell you, now I started to walk or I jog. Also, maybe the numbers are skewed because I see a lot of sports people or athletes, whether professional or amateur. But that is very different from the past, where most of the time people would come to hospital because of bone pain are old shushus and grandpas or guys who've fallen, gotten accidents, injuries of that sort. So I think the health, being in charge of your health and taking control of health is now a big thing, which I think it's an exciting time to be a doctor.
Yeah.
Because for me, an informed patient is always the best patient to interact with. A patient who is invested in their health. So they'll ask you the right questions, they'll do the right thing, they'll eat the right thing. That becomes an easy person to deal with. Because I'm not pushing you. I am not, it's like, you're told pushing a wall.
Yeah.
Because a lot of the time, previously that was the case.
Yes.
Now, not so much.
Now we're working together.
Yes.
Okay.
So we are working together. Sometimes the only missing link is maybe now information. Yeah.
Okay. And that's why we're having this conversation, because information definitely is power. And I like the fact that you've mentioned that previously we used to see more of the elderly population coming to hospital, complaining of maybe knee pain, joint pain or something. But even now, because of our lifestyles and capitalism, where you're in an office the whole day, I have been hearing from a good number of my friends, back pain is becoming a thing. I don't know if you've seen that, and what are some of the things we're not doing right? Because we are having, and you've had the thing for when you turn 30, joint pains, you just know it's about to hit you.
Yeah.
Should it be like that, or there are places where we can optimize?
So I keep telling patients, this the work from home culture or the fact that employers realize my workers are more productive if they don't have to commute.
Yeah.
They're at their desks by 7 a.m. and they're still seated there at 7 p.m. Is excellent for employers.
Yeah.
It is horrible for them, for the workers. Because if you're working in your house, this can be an excellent working space. I am comfortable on my couch. I'm on the floor. I'm in bed. So in terms of posture, just support, we don't think about it. It's where am I comfortable on my laptop, so I'm on my back and working. We don't move a lot. So the most movement some guys are having is bed, bathroom, desk, kitchen. And that's your circuit. And you'll probably be doing that just for a week until you leave the house. Even those who definitely go to the office, you're seated on a chair, 8, assuming you have maybe a bathroom break or tea break and then to lunch. So you're sitting for extended periods of time. That does nothing good for your back, for your posture. So yes, I'm definitely seeing a lot of back pain in the younger population. I'm seeing a lot of that in office guys or guys who work from home. And a lot of it is just you're not moving your body. So I keep telling them, you'll sit in a chair, so you'll get interesting requests. And I mean, I don't fault them. They'll say, I need an orthopedic chair.
Yes.
Or can I get an orthopedic mattress? And I'm like, yeah, it's true. But if you put a bad back in a good chair, you'll still get up with a bad back.
Ooh, punchline.
Yeah.
Okay.
So what can I do to fix my back? When you sit in that chair, it's not the chair that's holding you up.
Okay.
It's your core. It's your back. So if these things are not conditioned to do the work you're expecting them to do for 12 hours straight, they'll get to a point and then they'll bail out. And how will they tell you they've bailed out? You'll get spasms. Then you'll get pain.
Maybe you can tell us what a spasm is.
It's a muscle pull.
Okay.
So muscle pull on the leg, I don't know if you'll be able to see my leg. Your leg will probably go straight and you'll be unable to move. But with your back, the only thing, you'll have back pain. And then when someone calls you, turn like a bus. So you can't turn your neck. You're just the whole body. Yes.
Oh,
and,
okay.
Yeah, because your back is stiff.
Yes.
So for me, you'll come and I'm like, yeah. You'll tell me the story and I'm like, yeah. My work here is 1%. I will listen, I will examine, confirm there's nothing else going on. But 99% of the work is you. You have to get moving. You have to start physio, then just an exercise routine. Even if it's 30 minutes in your house, get your muscles moving, get your strength and conditioning in, so that then your body is capable to do what you want it to do.
And I've been hearing a lot about strength and conditioning. How relevant is that, especially from an author's perspective, and for just longevity of life? Yeah, and quality of life as well.
So we are a mechanical structure. You have the framework, the skeleton. So we'll talk about that when we're talking about bone health.
Okay.
But then I need to move from point A to point B. How do my joints move? How do my arms, my legs, everything? It's all muscle function. And movement is determined by your muscle strength and conditioning. So if you'll only get from your muscle what you have trained it to do. Okay. So it's you teach your body, you train your body, you train your muscle. And so strength and conditioning is key because it keeps your muscles functioning, it keeps them mobile, it keeps your joints stable. Your mobility, your independence is directly related to your muscle function. That and of course your bone health. So it's a big component of it needs to be a big component of what you do, particularly within certain age groups. So there's a certain age. So they say usually, especially for women after the age of 40, we've usually reached peak max of what we can get, even in terms of muscle bulk and conditioning. But now, how do I maintain that? Because if I don't, then it's just a gradual decline. A gradual decline, then now you start to get joint pain because it helps support your structure. So you have the framework, then you have you're supporting. So if that is not working, your framework it's constant, of course, outside of now bone issues. But if you're not conditioning your muscle enough that it can support your framework, then you'll struggle. You'll have pain with basic movements. You'll not be able to pick things off the floor. you'll fall pretty easily. I mean, like stumbling and even just regaining that balance and control. It's a factor of just how your muscle function works.
Oh, that's so interesting. Okay, okay. And now, because at least we know muscle is supporting your bones and your joints, so let's talk about bone health.
Okay.
Define for us bone health, if you can, please.
So we'd look at it as the strength or density or integrity of your bone. Okay. So if you think, like the way like rock is.
Yeah.
So I have coral. It has it's type of rock. Anyway. It has a lot of air spaces. You have dense rock that is very hard and it's heavier. So if you think of bone in that way, it's how much strength does it have? What is its integrity? What is its capacity to withstand force? Okay. So I know it may not make sense to a lot of people when I say bone has elasticity to it. When you think elastic, you'll think my hair tie. Yeah. But bone has that because there are certain positions you'll go into and it doesn't make sense that you're holding that position. But it's because then your bone has that elasticity to bend and change. But if we lose that, then it becomes brittle. So any change or any force through it causes it to break. So when you're talking about bone health, we're just looking at its strength, its integrity, its capacity to withstand force.
Okay. And lovely. And now you talked about bone density. And I know there are some people who've gone to hospital and you've been told, oh, your bone density is low. And for us, we think osteopenia, osteoporosis, which might be big terms, but how do we break it down for them to understand?
So osteopenia and osteoporosis are a continuum. Okay. So you get to one before you get to the other.
Okay.
So when we think of bone density, we have what is normal and what would be peak. So we would compare that with someone in their 20s or by the time they're getting to 30. This is max peak bone density. By 30, you've reached 30, 35, you reached your peak. You can't get higher than that.
Okay.
Then now when you get to osteopenia, it's starting to weaken. So you're starting to lose that strength. You're starting to lose that density or the thickness of bone. When we now get to osteoporosis, it's the end spectrum of that thinning process where now you hear orthopedic surgeons speak of an x-ray and say, oh, that bone looks like powder or that bone is like Weetabix. Like I put a screw and it just spinning, it crumbles or it just disintegrates. So osteoporosis is the end of that spectrum. Again, osteoporosis is a range. Okay, so their numbers are not probably to bombard them with your audience with numbers, but there's a scale that we look at. So if you think 0 is normal, so 0 can be a good number. So 0 is normal, and then on the number line we have positive and then we have negative. So when we're looking at 0 as our baseline, the further away from 0 in the negative direction I am walking, then the worse my bone health is. Okay. And so that's what those numbers are. They inform us and tell us, okay, we're either dealing with osteopenia or we're dealing with someone who is already in osteoporosis, and then subsequent assessments is usually to determine, is our treatment working? Okay. So that's why we would then say we do serial exams. Some school of thought say we'll do it every 6 months if you're in treatment, or every year, depending on what we're dealing with, and then monitor. Are the drugs we're giving, are the interventions we're giving actually working, or do we have to change course?
Okay. Lovely. And now that you said you reach peak by 35, Apple, that's peak density.
Yeah, so kuna wengine wetu tuko sasa on the flip side.
That. But how do we maintain that, or how do we ensure we've gotten the best that we can get? I know diet and nutrition is a very important aspect, and you brought in supplements, which of course we're seeing becoming more and more of a trend. But before we get to supplements, which many times is actually recommended by authors like yourself, how can we leverage on diet and nutrition first, and then we'll talk about supplements later?
So allow me to first, before we speak about diet and nutrition, let me talk about activity.
Okay,
sure. So as authors, we usually say your bone strength is directly proportional to the stress you subject it to. Now let me break that down into English or into Kenya. The guys who walk from Kangemi to industrial area every day, morning and evening, their bone quality is significantly better. Now, this is assuming they have nothing else as a medical condition. Or the part of the walking nation who will walk everywhere. Their bone health is significantly better than I, who will get in my car, drive to the gym, get in the lift, take the lift up to the gym, and then work out.
Okay.
And so they're stressing their bone. There's a lot of high impact activity through that bone. So the more stress you subject your bone to, the higher your bone density, or the better the stronger your bone gets. Okay. So if we're doing that in our 20s, so if you're doing high impact stuff in your 20s and your 30s, as you're moving towards peak bone density, so you're running, you're hiking, you're walking, skipping, as you're approaching 30, you're increasing your bone density. So think about your bone like a bank. So the more activity I do, the more I deposit in the bank.
Okay.
So we could both be the same age at 30, but I have been running, hiking, jumping for years. You have not.
Yeah.
I have a better bone bank than you do. Okay. Then now once we tip over after peak, and now we're getting to that either maintenance phase where we're not really adding more. So you have a bit of addition, but it's not in large chunks.
Yeah.
And now what we're doing is maintenance. Then that stress continues to be beneficial. Then now for women, there's then another challenge up ahead in terms of just menopause and what that does.
Yeah.
So if you keep depositing into that bank by way of activity, then your bone health is definitely going to be better. Okay. This is, of course, assuming at baseline you're healthy and have no other medical conditions, or you're not on drugs that will affect your bone health. If you look at your bone, or if you think of your bone as a seesaw, you know that thing you used to play with in the field when you were in primary school.
Yeah.
So new bone is forming, old bone is being cleared away. So when you're getting to that peak, that balance is there. Okay. Now as you age, it starts to tip more in favor of clearing of old bone, but you're not forming new bone quite as fast.
Okay.
So if I have enough bone density to cover for that shortfall, then you'll find your bone health is pretty stable throughout.
Okay.
Of course, now save for hormonal changes and stuff like that, which we'll talk about.
Yeah.
Now, what do we need for bone health?
Exactly.
Okay, so what are the building blocks?
Yeah.
So
hey, building blocks. I love it.
You can tell how we play with Legos.
Yeah.
So calcium. It's the single largest component of your bone.
Yeah.
So where does it come from?
Your diet.
Your diet. So we usually say, and the push is, and I believe every doctor is for dietary sources before we supplement. Let's get as much as we can from what we eat.
Yeah.
So what are we looking at? Dairy products. So your cheese, your yogurt, milk, leafy vegetables. Now it's interesting. I love spinach. Spinach interferes with calcium absorption.
Okay.
So you can imagine creamed spinach.
Yeah.
It is like the perfect oxymoron. I have enough calcium, but then I can't absorb it. So I've recently learned that my favorite vegetable doesn't really help me much. So, and grain, and you have fortified flours, you have fortified milks. So dietary options are the best. Now vitamin D, sunlight. So then your body will then produce it or process it to what is then active vitamin D. But now skincare, there's also a big push towards, healthy skin and skincare. So sunscreen, that becomes a factor. We're spending a lot of our time indoors because of the kind of work we do. We have shift-based work. So if you're doing night shifts, it means during the day you're asleep, you're at work at night. So you're not getting as much sunlight. Of course, then there's a seasonal variations. We're equatorial, so for us, that's not a big thing. But of course, depending on where you are in the world, then that's also a factor to take into consideration. So because of that, then supplementation of vitamin D becomes an important factor.
Yeah. Can I add to that? There's something I just learned as well. Melanin. If you're melanated, you need to spend more time in the sun than someone who's not melanated. So that's also a factor.
Yeah. So Those who look like me.
And me. Yeah, you need to spend more time in the sun. Yeah.
So there's of course then the dietary. So supplementation comes. It's exactly that. We supplement. We're not replacing. We're adding on to what we've already acquired in from our diet. So if you're eating a balanced diet, you're getting enough time outdoors, then supplements are not particularly necessary. If you're able to get everything you need, then you don't need to supplement. There, of course, is a subset of the population. So those who are either vegan or lactose intolerant or cannot do dairy, then you will definitely need some form of supplementation. There are those who can't be out in the sun because of medical conditions. Then you'll need to supplement.
And medication as well, some medication.
Yes. So there are those who are on certain drugs which affect bone health. So then we will definitely need to counter that. So if you're someone who is on steroids for whatever reason, I mean, there are those who have asthma and the like and are probably on long-term steroids, people with what we call inflammatory conditions like the rheumatoid arthritis, lupus, you're on steroids for extended periods of time. So to protect your bone, then we'll give you calcium, but you can't give calcium alone because calcium cannot be absorbed in the absence of vitamin D. So whenever someone is giving you a supplement, please confirm if it's calcium. Either get supplemental vitamin D in combination so that you reduce how much you're taking, or have them as two separate things. Because you'll take the calcium, you can't absorb it because you don't have the vitamin D, and then it's just excreted. So it didn't really help.
Okay, that's actually very important to mention. Okay. Might I add one?
Yeah.
And this is just what I remember from med school. Also, chronic kidney disease.
Yes.
They need to be on supplementation for vitamin D.
Exactly. Chronic kidney disease, people who have malabsorption syndromes like Crohn's disease, celiac, what is it called?
Crohn's, celiac disease.
So guys who have issues with absorption of nutrients or just absorption within the intestine need supplementation because they're not able to absorb enough from their diet. People who are on ARVs, there are certain subset of ARVs that cause osteoporosis. And the unfortunate thing is we find out down the road, and because this is lifelong treatment, it's important that if you are diagnosed with HIV and started on ARVs, please ask your doctor that, I mean, does this drug affect my bone health and do I need supplementation from the get-go? Because you can go in with healthy bones and then 2-3 years down the road, we are now struggling to fight back osteoporosis. And believe you me, it's a difficult thing to reverse.
Okay. Now, we've talked, so I think bottom line, supplementation is not bad, but then it has a place and a purpose. So I think it's just encouraging us to find out if we actually need the supplements or if we can optimize our diet first, and then if we need the supplements, then we can build on that.
I think one other thing just to say about the supplements is when looking, I hate taking meds.
Same girl.
So if you tell me I have to take a tab, I'm like, okay, let it be one. Okay, one in a day. But something like now for things like calcium, you'll have guys who will give you like prescriptions where it's like 1,500 milligrams of calcium per tablet. Your body can only absorb about 500 to 600. So the rest is discarded. So you have to take it in small chunks. So it's one of those things that twice a day tablets. Or just do the supplement. If you're good at getting good dietary intake and you just need the one tab, 500-600 milligrams tab should be fine if we're supplementing. But the ones that are large, quite honestly, a lot of that is just being excreted because your body is not able to absorb that much.
And I like the fact that you brought that up because I don't think many people mention that sometimes supplements need to be prescribed and the dose is very important. So even I have a couple of friends who've been diagnosed with vitamin D deficiency, and it's so deficient that you can't be on tablets. You need IV. And for that, you need, of course, a prescription. And I think that's why I'm very vocal with saying, please go and have your levels checked to see how bad the deficiency is and what is the recommended dose for the supplementation that you require. So not everything will be over the counter. So you can't skip your doctor here.
And supplements are accessible anywhere.
Yeah.
The thing is, if you have too much of something, it's poisonous.
Yeah.
So you've had guys who are on calcium supplementation and then end up with kidney stones. I mean,
Yes.
you just had too much.
Yeah.
And you didn't need it. So
And kidney stones are painful.
ooh,
Painful.
Yeah. We've gone
You've
to
dealt with a
hospital.
couple?
Yeah.
Yeah.
Where patients are going to hospital, they're calling you at like 2 a.m., 3 a.m., and they're like, now we're going to hospital now.
Yeah.
I mean, it's outside of labor. Okay, maybe not to diminish anyone else's perception of pain.
Yeah.
But I quite honestly think kidney stones could potentially be a close second. Because I've seen a number of guys suffer through it, and
it's unbearable.
I would not wish it on my worst enemy.
Yeah. But you've talked about excess, but also insufficient amounts. There's some multivitamins that if you look at the ingredients and just the daily, the allocation of whatever supplement it is, it doesn't meet the daily dose.
So, yes. But when you think about it as a supplementation, then even if you're getting a small increase, if whatever you're getting from your dietary sources would be sufficient, then this is a small boost, probably either because of activity or whatever other reason you're taking it. I do not fault an under dosing or under prescription of the multivitamin because it's just that it's a multivitamin. I'm adding on to whatever I've already got from my diet. But if now I'm using it to treat someone who has, say, osteoporosis or significant osteopenia, then I would be doing them an injustice if I am prescribing it for that and I'm underdosing them. But if it's someone who's I just want to up my nutrient intake, I won't fault that particular brand or that particular tablet because that is its purpose. I am supplementing.
That's a good
But if it's for treatment purposes, then the onus is on the doctor to do right by their patient.
Okay. Now let's go to being a woman. Because our hormones contribute so much to bone health, and of course we'll talk about menopause. But is there anything that a young lady needs to know about her hormonal health in relation to bone health?
Okay. So I keep saying, being woman is your hormone, just your general body. It's your greatest asset.
Yes.
But it can also be your Achilles heel if not well controlled. So for the young female, whenever you think about your period, so depending on what relationship you have with it, there are those who, and it varies. I mean, it could be the worst time in your life every month, or it could be just another day in the month and life goes on, and then there are those, it's an excruciating experience, and so having to relieve it monthly is also just a nightmare. But it's very important because the hormonal balance within our body, particularly hormones like estrogen, are very protective. Okay, they will help with calcium absorption and protect our bones, so improve. So if we think of the cells that build our bodies as a bone building cells, and then there are those who destroy. So estrogen works primarily by encouraging the ones who build and suppressing the ones who destroy. And so anything that interferes with our menstrual cycle, anything that interferes with our hormonal balance, has a direct impact on our bone health. There's something in sports we call the female triad. Particularly if you look at our athletes. I mean, if you're going to be a long distance runner, if you're going to be a gymnast, if you're going to be, and particularly sports around women, there's a certain body build that is expected or is considered ideal for that sport. So they're very tiny, very lean. And that can be because of probably working out. Yes, so you have a lot of energy expenditure by way of training, but they're also trying to maintain that physique. You have a low calorie intake.
Yeah.
So you end up with an energy deficiency. Now, that energy deficiency, your body is like, now we need to survive and we need to move. So do we really need our period? No. So your reproductive health takes a back burner.
Okay.
And so we stop having a period. So your hormone health or your hormone balance is thrown out of work.
Okay.
So estrogen levels drop, stress hormones go up. So then you stop having your period. That's one of the first signs that, oh, actually, my reproductive health is a problem.
Okay.
Now, because I have low energy deficiency, my reproductive health is secondary now.
Yeah.
Estrogen levels are also plummeting. Then what happens to my bone?
Weekends.
Remember the estrogen that was boosting guys and suppressing?
Yeah.
Now the guys who are supposed to be suppressed
The sisu is
now have
reversed.
a party, and so your bone now starts to get resorbed or basically broken down. So particularly now in the gym, I've met a number of people. There's a big push towards high protein intake, which is excellent, and eat a balanced diet, and I love that narrative.
Yeah.
But then there's still that group of people who say, I'm going to eat at a calorie deficit and I'm going to work out and do this, that, and the other to try and maintain this physique, but not knowing that you're actually harming yourself. So there's the one who's doing it because they want to fit into a particular size mold. Then there's the one who's doing it because their sport demands of it. And so they're definitely then damaging their bones. So I know the question was, what do we do about our hormone health?
Yeah.
So whenever we have issues with your cycle, you don't visit a gyna only when you're pregnant or when you have other issues. I think this is someone that you need to have. Every female needs to know, or at least have access to reproductive health. Where am I at today? What is going on? What do I need to do? Am I having, regardless of whether you have a regular cycle and have no issues, or even if your cycle is irregular and you've had issues, I don't think it's one of those. There's no shame in, I'm going to see a gyna. Why?
Yeah.
I am just, I mean, you take your car to the garage for service.
Yeah.
It's running, but you take it.
Yeah.
So I think for females, that's an important relationship to have. Our relationship with food and what it is for us particularly, because it's a key component to every aspect of who you are. So don't shun certain food and say, but then I'll gain weight. I'd rather you eat it and then you do cardio, but then you're not starving your body of whatever it requires. But also activity. An active lifestyle in your youth definitely gives you longevity.
Okay.
Yeah.
Okay.
Yeah, I think.
Yeah, I think that's good.
Yeah.
And now just listening to what you're talking about, especially when it comes to sorry guys, I'm recovering from a flu.
Poor lady.
Especially when it comes to now reproductive health. With one, let me talk about other hormones, not just estrogen. Maybe you can touch on thyroid and how, because that affects metabolism. And then we can also touch a bit on weight management. So for individuals who are now getting on the Monjaros, the GLP-1s, let me not mention names, but the GLP-1s, how is that affecting their muscle and their bone health? And what would you encourage them to do even as they're on this medication?
So actually, very good question. So whenever we think of hormones, I think the first place we go to then for females would be your reproductive hormone.
Yeah.
But then thyroid, parathyroid, diabetes is a hormone problem.
Yeah.
It's an endocrine problem.
Yeah.
All these affect bone health. So your thyroid hormone is directly linked with your bone health. I don't know if you remember signs and symptoms of
It was hyper Graves, was it?
There was moans, groans, bones, and psychiatric overtones.
Okay.
Something like med school.
That's one I didn't get. That's mnemonic. I missed that one.
So when you're thinking about like now high thyroid levels,
Yes.
these affect calcium metabolism, your calcium absorption.
Yeah.
If you have excess parathyroid hormone, it actively
Yes.
activates the cells that destroy bone. And so then if I have that skewed in that direction, then my bone is affected. If I am on drugs that suppress my thyroid, if I have high thyroid levels and I have drugs that suppress that, a constant suppression of what we call the thyroid stimulating hormone also affects calcium absorption.
Yeah.
The same thing with diabetes. It's a constant inflammatory state, which affects your gut health, calcium absorption, just affects your vasculature, which affects blood supply to your bones.
Yeah.
So all these things have a role to play. Now, the GLP-1 off-label use for weight control, I think has given very many people license to live a healthy life.
Yes.
I mean, there are those who've struggled with obesity and weight loss, and it's one of those we say it's a balance. So you're heavy and you would want to lose a weight and get moving, but your joints hurt so much that you can't move. So where do we start in this journey? So I think that has given people a lot of license, I mean, to live the life that they want.
Yeah.
But it works by reducing your appetite.
Yeah.
So it works by reducing your food intake. So what does that do to your nutrient intake? So we definitely see a lot of muscle mass loss, because if I'm losing my daily dietary requirement, then I can't keep up.
Yeah.
I can't maintain. So we lose a lot of muscle mass. Bone health, not as dramatically, or at least in the few patients I have seen in the clinic who have been on it, we've not seen a big shift in bone quality.
Okay.
Probably because they're also doing it when they're still within their 30s, 40s age group, and your bone quality at that point is not too bad. So maybe may potentially see the actual and true effects on bone health down the road. But in that subset, I mean, if you're not eating enough to get your nutrients in, then supplementation is a good thing to do. You're eating less, your energy reserve is definitely less. So you'll struggle to move. You'll struggle to have, especially I think in the initial phases. I know of people who've been on it, but I've not had a conversation one-on-one with someone who has. So this is all from just reading.
Okay.
But I mean, their energy levels are low. So you will not be able to exercise much. But that little that you can do, please do, because then you need to keep stressing your bone. But you also need to work a lot on muscle strength. We work out for toned muscles and a toned body.
Yeah.
But yes, it looks great.
Yeah.
You look amazing. But what is the actual functionality of that? The tension of that muscle on bone, that stress and that tension helps stimulate bone production, slow down bone resorption. So if I am losing a lot of muscle mass, my muscle is getting lax, my muscle is getting weak, that in itself will also affect my bone health. So I think power to those who are on it and have taken control of their life and those decisions and their decision to be healthy in that way.
Yeah.
Now we just need to add now the components of, yes, we've lost the weight. What else has it done to the rest of my body?
Yeah.
And so how do we compensate for that loss?
Okay.
Yeah.
Okay. And they should be happening concurrently. We recommend.
Yes.
All right. Now let's talk about the perimenopause and menopause around that period. What should we look at, focus on, just to make sure that as we step into menopause now, when the estrogen just says bye, at least bone health is something that we've been able to preserve so that we're not having the challenges later on in life. Yeah.
So if you're 20, start now.
Yeah.
If you're 30, start now. If you're 40, start now. So the ideal would be, in a perfect world, everyone started moving and started exercise in your youth. And you've built up that bank reserve to its maximum. And so as you then transition into that phase of my hormones now are, the seesaw has tipped in the opposite direction.
I love that analogy.
I have enough reserve that it can tide me over. So as I'm just supplementing and I'm continuing with my exercise routine, there's in your 20s and 30s, the push is towards high impact activity. Stress that bone, run, jog, hike, skip. When you get to your 40s, now, because we are not replacing as fast, the push is now more towards strength and conditioning.
Okay.
So can I maintain my muscle tension, my muscle strength, my muscle conditioning, so that then it's also pushing and stressing my bone in that regard. So if we maintain an active lifestyle, for me, I think that is number one. Okay. Of course, as the ortho, movement is life.
Yeah.
So for me, that's number one. If you can
Yes.
do that and build that culture
Yeah.
and that lifestyle of movement,
Yeah.
exercise, and then do the right exercises. So there are those who will come and tell me, I swim and I cycle, and I'm like, great, excellent. I love that you do that. It's excellent cardio. But we need something for your bone. So can we add a day in there where you're walking or you're running or you're doing just something high impact? Because we're doing a lot. Cardio is your heart. I mean, your heart needs
Fantastic.
fantastic. But can we also add something for your bone?
Yeah.
So in the same breath, then for the woman approaching perimenopause, can we do strength-related workouts? And it could be low impact, resistant bands, light weights. There's now a big drive towards Pilates.
Yeah.
Yoga. I know most people think yoga is stretch. And,
Holding those poses.
it requires a significant amount of strength.
Yeah. Yeah. It
And
does.
you build over time.
Yeah.
And it's we're not asking you to go and do. I mean, if you can do the deadlift, great.
Yeah.
I mean, if you can do the squat, great. If
But
you
build your
can't,
way up.
just build your way up
Yeah.
and work with what you've got.
Yeah.
And the more you do that, then you'll realize funny pains you had, knee pain, you'd get up from a chair and you have to hold the sides of that chair to get up like your grandmother.
Yeah.
That goes away.
Yeah.
And you're more agile, you're more mobile, you feel more stable and more secure. I know people who going down the stairs is a very daunting experience just because they're not too sure if my legs will hold me or if they'll bail out as I go down.
Yeah.
And so if you can just work on that, then you just get up and go.
Okay.
So for me, the takeaway is move,
Yeah.
move. Eat well, eat right.
Yeah.
Supplement where you need to, particularly if you're approaching perimenopause and menopause, because now we need to now supplement a lot more seriousness than we do in our 30s.
Yeah.
For now, for us, I think in our age group, it's because it's now the thing to do.
Yeah.
But once you hit 40, you need to
needed.
do. Yeah.
Okay. Okay. Now, before we get to now the last segment where it's beyond the clinic, we're speaking earlier, and I had mentioned that I have a couple of friends who've gone through C-sections, and of course, to go through a C-section, you need spinal, which is the medication you're given to numb the lower half of your body so you can have the delivery. And after that, they complain of back pain. I think they call it spinal back pain. What do you recommend for management of that type of back pain? And maybe you can tell us why it happens.
Okay, so as I've had a number. I think I told you earlier that I've had a number of spinal injections for one reason or the other, and one, if you ever have the misfortune of seeing that needle, it's probably like
it's long.
It's long.
Yeah.
Okay. And the access point. So it's basically you're being stabbed by this very fine needle, but through very many layers of tissue. So we'll go through your skin, what we call the subcutaneous fat. Then we're going into the space between two bones in your spine. So there are ligaments that attach bones and there's tissue there. So think about it as like a tract or a wound or a cut straight through and back. Now, we can scar down. So the ones who get spinal with a very fine needle rarely will have a lot of scarring within that tract. But some, just again, depends on how you heal. You know, the guys who get keloids or what we call hypertrophic scars. So you tend to be a very enthusiastic scar former. And so you can get a lot of scarring within that tract. Now, scar, unlike normal ligament muscle, doesn't stretch. So they may tend to say, my pain is worse when it's cold or even in a cold place. and it's because scar is tight. So
Yeah.
that segment of your spine just feels very tight.
Mm-hmm.
Okay. Now, outside of just a lot of warm up and stretching, we can't do much about scar. But the most common cause of back pain, I wouldn't even say it's post C-section.
Okay.
So we will always attribute it to C-section because it was the trauma,
Mm.
the last trauma in that journey.
Yeah.
But it's usually muscular.
Okay.
And it comes as a result of pregnancy. So, you know, you stand straight,
Yeah.
then as your belly moves forward, your back starts,
curvature.
the curvature starts.
Yeah.
And your core muscles are stretched to within,
Yeah.
I mean,
They're
in fact,
really stretched.
they are all the way out there.
Yeah.
And so in the recovery phase, you find if you do not work pelvic strengthening and core strengthening to restore that balance, your back ends up being the workhorse. So your spinal muscles end up doing a lot of the work. But also if you do not condition and work on them after pregnancy, they do not go back to their pre-pregnancy level of function.
Okay.
And so now what you tend to get is actually muscular pain because of just weak back, core, and pelvic floor muscles.
Okay.
So for me, I think the message to all women, I think, as it were, whether you've delivered vaginally or you've had a C-section, your body goes through a lot. Your muscles stretch, your posture is shifted, the alignment of your spine. Pregnancy does a number, on the woman's body. And so there's post-delivery, yes, take care of baby and nurse baby, but I think take care of yourself.
Yeah.
So this is where just stretching exercises, pelvic floor strengthening, core strengthening exercises.
Yeah.
Of course, within reason. I'm not telling you deliver and go do this a week or 2 weeks down the road, but have that as a plan to go back. I think that will help.
Okay.
It helps a lot.
Yeah.
I think the same way we talked about posture and sitting and guys, for the female, it's the same thing.
Okay.
So take care of the baby, but you also have to pour into yourself as much as you did.
Yes, correct, correct. And I hope all the young ladies who ask that question frequently, I hope this is going to be helpful and that you can now try and focus on now that strengthening of your core muscles, your pelvic muscles. And I think also for pelvic muscles, they can have these conversations with their gynecologist.
Exactly.
For like, what are some of the techniques they can use?
Yeah. I think YouTube is the University of YouTube or the school. It's an excellent resource if you're able to find, because if you have access to a gym and you have access to a trainer, excellent. Of course, get one who knows what they're doing so that then you don't get hurt. But if you do not have the capacity to do that or you do not have access to that, there are short videos on simple things I can do at home. Back and core workouts for beginners. Then you build up your skill level as you keep going. So now, before you'd say we don't have internet at home, so my age is showing, or you don't have access to the internet, you do not have access to a gym, and so how would I do it? Now,
Now you have access.
Now you have no excuse. You have it on your phone, you have it in the house, you have a floor, you have a carpet, you have a body. Move it. Yeah.
Okay. We'll like to move it, move it. We'll like to move it.
Mega, we care.